My name is Kristi Grabill, and I'm a nurse practitioner. I'm a family nurse practitioner. I work here at Longstreet Clinic, and I'm a breast specialist. I handle all the patients that have an increased risk for breast cancer. I discuss genetic testing with them. We look at the best imaging scheduling for them for their risks, send them for breast MRIs, send them for additional screenings, manage their care, manage if they ever need biopsies, and additional references out to other facilities, because a lot of patients that have an increased risk of breast cancer may also have an increased risk for ovarian, pancreatic. So then I send them to other clinicians to follow up on those areas. I try to treat every single patient like they are either my sister or my mother or my grandmother sitting in front of me, and I provide the care that I would want my family members to have. And so all my recommendations are recommendations that I would recommend if my best friend was sitting in there, my mother, or myself. And I always try to put myself in their shoes of what they're hearing and what they're processing, and try to explain it on a level that they understand. A high-risk patient, basically we just keep a closer eye on them. We don't want to find breast cancer, but if we do, we want to find it when it's little. So we're watching them closely, staying in touch with them, recommending breast exams. I have a lot of patients that are high risk that do not do self-exams, so it's more education of not just self-exams and imaging, as well as it can be some changes in lifestyle. A lot of people associate, smoking with lung and cardiovascular, but it's an increased risk for breast cancer. So I go over recommendations in diet changes, exercise, weight loss, and then smoking, limiting alcohol, all the lifestyle factors. You can't choose your parents, but you can do some lifestyle choices that can reduce your chances for breast cancer. So some of the advantages of having come to a breast specialist that can manage high-risk patients is we have it in place how to manage. A lot of patients do not realize they are at a high risk, and that's where imaging comes in. Sometimes they're doing a lifetime risk score on patients that come in that have grandparents and aunts and first cousins that have had breast cancer and do not realize that it's an increased risk for them. So we find those patients, walk them through the process, and answer a lot of questions. A lot of it is just education, reassurance that we've got them, we're watching them closely, and we're going to be with them throughout the whole process.